Hello, this is Dr. Dorwit, and this is Anatomy and Physiology 1, Lab 4, the skeleton, Part 2, the axial skeleton, starting with slide number 30. Let's take it from the top. The skull contains two groups of bones, the cranial bones and the facial bones. The cranial bones surround the brain. The facial bones frame the face. Cranial bones. Cranial bones include the frontal bone, the parietal bones, the temporal bone, and the occipital bone, shown on this lateral view of the skull. Here we have an anterior view of the skull showing the frontal bone, and then the deeper cranial bones, the ethmoid bone and the sphenoid bone. Here is a posterior view of the skull. We see the parietal bones and the occipital bone. The sutures. The sutures technically aren't bones. They are joints. The coronal suture joins the frontal bone and the parietal bones. It sits where you would wear a crown. Corona means crown. The sagittal suture is located between the parietal bones. It lies in the mid-sagittal plane. The lambdoidal suture. That's lamb, like Mary had a little lamb. The lambdoidal suture joins the parietal bones and the occipital bones. It got its name from the Greek letter lambda. The squamosal suture. The squamosal suture joins the parietal bone and the temporal bone. It got its name because it is flat. The temporal bone. Temporal means related to time. Hair turns gray first in the temporal area. This is what the sphenoid bone looks like when it's taken out of the skull. It has a butterfly shape. The sphenoid bone is located posterior to the nose. This is what the ethmoid bone looks like when it's taken out of the skull. The ethmoid bone is located superior to the nose. Here are the facial bones, starting with the cheekbone, or zygomatic bone, and going counterclockwise. Next is the maxilla, that's the upper jaw, the mandible, the lower jaw, the other zygomatic bone, which is the cheekbone, and the lacrimal bone, which is in green, and one on each side. More facial bones. The nasal bones, one on each side, make up the nasal bridge. The lower part of the nasal septum is made of a bone called the vomer. There are three shelves that stick out into the nasal cavity. The lowest one is called the inferior nasal concha. On this anterior view of the skull, we see the inferior nasal concha as well. The middle shelf is called the middle nasal concha. The upper part of the nasal septum is called the perpendicular plate. It is part of the ethmoid bone. Just above the eye is the supraorbital foramen. Supra means superior to. Orbit means the eye socket. In time, the little piece of bone underneath the foramen crumbles, and the foramen becomes the supraorbital notch. Now, you label the markings. The supraorbital foramen is one of the structures related to the eye that we are responsible for. The others are the superior orbital fissure, the optic canal, and the infraorbital foramen. The superior orbital fissure is located superiorly within the orbit, not superior to the orbit. It is shaped like a slit, not a circle, and therefore is a fissure, not a foramen. The optic canal is just medial to the superior orbital fissure, and I will show it to you on the skulls at your tables. Just like there's a foramen superior to the orbit, there is a foramen inferior to the orbit, the infraorbital foramen. Infraorbital means inferior to. On the mandible, there is the mental symphysis and the mental foramen. Mental refers to chin. The mental symphysis is also called the mandibular symphysis. In the embryo, the mandible starts in two parts that later fuse. The mandibular symphysis is where they fuse. Slide 46 is identical to the previous slide 45. See if you can name the structures without looking at the labels. Okay. Slide 47. The main part of the mandible is the body. The ramus is the arm-like bar of bone that we discussed when we defined ramus. The angle lies between the body and the ramus. In this lateral view, we again see the mental foramen. The place where the teeth insert into their sockets is the alveolar margin. Inside the ramus is the mandibular foramen. This is when you go to the dentist to have work done on your lower teeth, and he or she tells you to open your mouth wider than you ever dreamed possible and sticks a long needle into the back of your mouth. He or she is injecting Novocaine around the nerve that goes through the mandibular foramen. The coronoid process sticks out like a triangle from the ramus of the mandible. The mandibular condyle fits into the mandibular fossa of the temporal bone to form the joint that moves when you open and close your mouth. The name mandibular fossa makes it sound like it is part of the mandible, when, in fact, it is the part of the temporal bone that is adjacent to the mandible. We will see this over and over, where a part of a bone is named after the bone that is next to it. The ethmoid bone, a view from the front. The ethmoid bone is that bone that is internal and just above the nose. Sticking straight up out of it is the crista galli, which is named after the fact that it looks like a rooster's comb. We see the middle concha and the perpendicular plate that we saw before on the anterior view of the skull. The ethmoid bone also contains two sinuses. Here is a picture of the temporal bone by itself. Starting at 10 o'clock and going counterclockwise, we have the external auditory meatus, underlying the ear, and the mastoid process, the bump that we felt earlier when we discussed the definition of a process. Next is the styloid process. Styloid means peg-like, but I like to think of it as a stick. Stick and styloid both start with the st sound. The styloid process sticks out of the bottom of the skull. Next is the mandibular fossa, where the mandible fits in, and then the zygomatic process, which is adjacent to the zygomatic bone, but not part of it. This slide is for your labeling pleasure. Superior view of inside of skull. This view is looking down into the skull. The top of the illustration is anterior. We see the crista galli that we discussed with the ethmoid bone. On each side of the crista galli is a flat area with lots of holes in it. This is the cribriform plate. Remember that the ethmoid bone is just above the nose. Neurons that carry the sense of smell pass through the holes in the cribriform plate to go from the nose to the brain. The next landmark is a depression called the sella turcica, which is located in the sphenoid bone. The carotid canal is tricky to find on the illustrations. I will show it to you on the skulls at your tables. The jugular foramen is posterior and lateral to the carotid canal and is larger than the carotid canal. The foramen magnum is the great big hole in the occipital bone. Which important structure passes through the foramen magnum? That's right, it's the spinal cord. Here's some fun facts about the sella turcica. Sella turcica means Turkish saddle. It looks like a saddle. Which important endocrine gland is located here? The pituitary gland. The sella turcica is part of the sphenoid bone that is located right behind the nose. In fact, if the pituitary gland has a tumor on it that needs surgery, the surgeon gets to it through the nose. Inferior view of the skull. This is a view from the bottom looking up. The front of the hard palate is made of the palatine process of the maxilla. The back of the hard palate is made of the palatine bone. We see the vomer again from a different angle. The occipital condyle is part of the joint between the skull and the first cervical vertebra. Inferior view of the skull. We can also see the carotid canal and jugular foramen on the inferior view, and the mandibular fossa. That concludes the discussion on the skull. Now we will proceed to the regions of the spine and its curvatures. The spine has 5 regions: the cervical region, which is the neck, the thoracic region, the lumbar region, the sacrum, and the coccyx or tailbone. The cervical spine curves into the front. We call this concave. The thoracic spine curves the opposite way. We call this convex. The regions of the spine curve in alternating directions. The lumbar spine is concave and the sacrum is convex. The sacrum and the coccyx are made of fused vertebrae. The cervical region of the spine is made of 7 vertebrae. The thoracic region of the spine is made of 12 vertebrae. The lumbar region of the spine is made of 5 vertebrae. 7, 12, and 5. Think meal times. This is an illustration of a genetic vertebra. The largest part is the body. Next to it is the vertebral foramen. Which structure passes through the vertebral foramen? The spinal cord. The spinous process sticks straight out to the back. To each side is a transverse process. The first 2 cervical vertebrae are special. The first one is called the atlas. The mythical Atlas carries the weight of the world on his shoulders. The bone Atlas carries the weight of the skull on its shoulders. The Atlas had a body at one time, but it has gone missing. It has no spinous process. The Atlas forms a joint with the occipital condyles of the skull. The second cervical vertebra is called the axis. The skull spins around the axis, but not all the way around like in The Exorcist. The dens is a tooth-like projection that used to be the body of the atlas. This photograph shows the dens in a lateral view. The vertebrae in each region of the spine have common characteristics that differentiate them from other parts of the spine. A cervical vertebra has the smallest body. The vertebral foramen is triangular in shape, not circular. The spinous process is split. Bifid means split. The transverse processes contain foramina for the vertebral artery to pass through. Thoracic vertebrae. What characteristics differentiate thoracic vertebrae from the other types of vertebrae? Well, first of all, thoracic vertebrae have a medium-sized body. They have a circular vertebral foramen and extra facets for the ribs. And the spinous process of the thoracic vertebrae project downwards, straight down and sharp. Lumbar vertebrae. Lumbar vertebrae have a large kidney-shaped body. That in and of itself is usually enough for identification. Lumbar vertebrae have a triangular vertebral foramen. And lumbar vertebrae have short spinous process that points directly backwards, not downwards as in the thoracic vertebrae. The sacrum represents 5 fused vertebrae. The ala are the wings of the sacrum. The sacral foramina are the holes through which the nerves pass. The median sacral crest represents the spinous processes of the vertebrae that fused. The hyoid bone. The hyoid bone is not connected to any other bone. It is an attachment for the muscles of the tongue. The sternum. The sternum is the breastbone. The main part of the sternum is called the body of the sternum. The shield-shaped top of the sternum is called the manubrium. You can easily feel the jugular notch on top of your own sternum. Run your finger down your midline. At the junction between the manubrium and the body, you can feel a bend. This is the sternal angle. The xiphoid process is at the inferior end of the sternum. The ribs. There are 12 ribs, all of them attached to vertebrae. Some of them attach directly to the sternum. Some of them attach indirectly to the sternum. Some don't attach to the sternum at all. Ribs 1 through 7 attach directly to the sternum and are called true ribs. Ribs 8 through 12 do not attach directly to the sternum and are called false ribs. Ribs 8 through 10 attach indirectly to the sternum via their cartilages. Ribs 11 and 12 do not attach to the sternum at all. They are called floating ribs. The rib. The head of the rib connects to the vertebra. Next to it is the neck of the rib. Next to the neck is the tubercle. Seeing the tubercle is an easy way to determine which end of the rib connects to the vertebra. The end.